basically, it's based upon the most modern neuroscientific understanding of pain, which in very high level and brevity is that while we feel pain in the tissue, the origin of the pain is not the tissue, it's the central nervous system, which is driven by the brain. So you could say that it's a brain-driven phenomenon or a neurogenic phenomenon. Now, when I say brain, I'm not talking about the conscious brain. I'm talking about, deeper ancestral evolutionary brain functions that drive these kind of responses. And when we have an injury or the threat of an injury, that pain is a protective mechanism. Hand on the hot stove, broken ankle, God forbid, growing, cancer in our tissue. We want to feel pain, even though it's uncomfortable, because it gets our attention and helps us navigate that acute reality, learn from our environment, and stay safe. But when pain becomes chronic, and by definition, that means pain that's sticking around longer than is appropriate, or growing in intensity beyond what is appropriate to a cause, or in some cases, maybe like fibromyalgia, there may not be a clear cause. It's just kind of spontaneous pain that's growing in the body. This is not protecting us. The message coming out of the device or the waveform is dynamic and changing, or in other words, it's scrambled. And so when we attach electrodes on the skin, similar to a TENS unit, but typically not right in the pain area, outside of the pain if possible in the healthy tissue, we transmit this artificial no pain message out of the device. But unlike a TENS unit, which has a static waveform, like maybe you can adjust the peaks and valleys, but the waveform is the same, Scrambler Therapy creates an ever-changing dynamic and scrambled sensory experience.
I'm John Hong. I'm a board-certified interventional pain specialist. I've been in private practice for nearly 2 decades. So I've seen the full gamut. I've treated with all the conventional modalities, including medications and nerve blocks, injections, spinal cord stimulators, and some minimally invasive spine surgeries as well. There's actually a good amount of published research and studies on this at very reputable institutions. So, after practicing almost 15 years at that point, I was like, why have I never heard of this before? I started incorporating Scrambler Therapy into my practice and had some pretty remarkable outcomes, especially for chronic neuropathic pain. So, when you look at the risk-benefit profile, there's essentially no risk. It's a non-invasive transcutaneous electroanalgesic therapy at very low levels.
We've seen a very significant reduction in pain. Typically pain is measured on the VAS scale from 0 to 10. We see on average about an 84% reduction in that pain score at the conclusion of those 10 to 15 treatment sessions, as Dr. Hong said.
You mentioned the New England Journal of Medicine paper. I mean, one thing that it really highlights very clearly is the difference between the TENS unit and the Scrambler Therapy unit. And the key difference is that Scrambler Therapy has been clinically proven in multiple studies to provide durable pain relief. I feel like a lot of the patients that I've seen benefit have been truly treatment refractory patients that have failed all other modalities. And it's very, once you see it happen, it's pretty miraculous that this device is actually helping them. Every market, there's no shortage of patients that are struggling with chronic pain issues. Even in markets that are saturated with pain doctors, every pain doctor has probably like 10 to 20% of their patients, in their active clinic that are just being maintained, that are still just in a pretty substantial amount of pain.
So we would also present it as the fact that it's a process over time. Everybody needs probably at least 2 or 3 weeks of daily sessions. In the most severe cases like complex regional pain syndrome or other such things, they may need longer sessions. And so we would sell it as a package typically, and I'll give you the materials as we integrate this into the practice that we can help you modify. But there was basically like gold, silver, platinum, I think we called it. And the gold was, I believe, $3,500, which included enough treatment sessions. So we'd say, like, if you wanted to just pay a la carte, it's $300 a session. But as you started buying package with more, quantity of treatments, that per price goes down. And then we would also tell patients, like, if you invest in one package, but one of the other packages would have actually saved you money, we'll let you toggle and we'll never charge you more than you would have charged on whatever package was more appropriate.